Hi guys, so my name's Arj Imbuldeniya and I'm a consultant orthopedic surgeon. So I tend to treat patients with problems with their hips and knees and also traumatic injuries, which generally means fractures and ligament injuries. So why did I decide to become a doctor? That's a good question actually. So the real answer is, well, there's twofold answer actually. So one is sadly my dad passed away when I was quite young, and I remember we had to visit the hospital quite a lot back then because he wasn't very well for a long period, and we didn't really understand what the I guess sort of how the doctors were explaining things to us back then, and I certainly felt a little bit powerless to kind of help. And in the end, when he passed on, I sort of felt we maybe could do with like a medical person in the family because we didn't know anyone. So that was one of the drivers. The second driver was this American program came out called ER, and it's like the one that starred George Clooney, and they just looked like like a really cool job. He looked really cool. I kind of wanted to be kind of like him basically. So it's a combination of sort of family experience and then a TV show. Maybe want to go for it. Obviously, I didn't quite talk about the TV show in my medical school interview, but I'm telling you guys the truth now, more than 20 years later. So why did I choose trauma and orthopedics? So it's just really fun, and I think in medicine, the good thing about the career of medicine is that there's so many different fields and branches that exist, and what that means is there's kind of one for everyone. There's different fields, I think, for different personalities, and I think all of the jobs are so different. You know, microbiologist is really different to a gynecologist, and they're different to a psychiatrist, and I'm an orthopedic surgeon. So I guess I'm not massively patient, and I like to fix things. So I get a problem and I want to like fix it and make it better. So I guess if a patient comes in with a broken arm, it's really nice to either fix it with a plate and screws or put them in a cast and you know, see them heal 6 weeks later, and then off they go, you know, back into the world. And same if you've got a really bad knee ligament injury, or you've got bad knee arthritis, we can reconstruct your ligament, or you can have a knee replacement, and then if all goes well, you're really happy, and then you get on with things. So I really like that aspect of it. I really like that it's quite technology based as well, and it's always evolving. We're always getting new tools and equipment to help us do our job better, and it's just kind of fun. So I think I chose the right speciality. I'm not sure I'd have been quite as happy or suited to a different branch of medicine. Where did I grow up? So sadly for me, worryingly for me, I grew up not far from where I currently work and live now, which is West London. So I grew up, so I was born in the West Middlesex University Hospital in Isleworth, and I now am a consultant there as part of the Chelsea and Westminster Trust. I've been in West London a lot. I went to school in Hammersmith, grew up in Ealing and Acton, so it's all West London. Went to university in London, did some training though, lived out in Australia for a bit and in Barcelona just to mix it up a little bit, and then came back home. So what I really like about my job also is that I get to serve the kind of local community that I know really well in and around West London, and I kind of understand the patients, I feel, because I know lots of the boroughs and the areas around West London. So yeah, so I'm very much from there, and I also have to give a big shout out to my beloved Brentford Football Club, who are now in the Premier League. So it's a great time to be me at the moment this year, unless of course we get relegated when this video goes out. So the question is, what do I find most rewarding about my job? And I think without doubt, it's just meeting people, meeting lots of different people, and then helping them basically, and having the skills to kind of meet someone who's had like years of pain, if it's chronic disabling arthritis of their hips or knees, where they just can't do the things they want to do, and you end up counselling them and taking them through a procedure that's successful. So that might be a hip or knee replacement procedure, and they can just get on and do things they want to do again, see their friends, go out and do all the activities they want and not be in pain. The other sort of type of thing is younger patients maybe who get injured doing sports and things, and they can't do the things they love, like football or running, and you fix a ligament or repair something that's torn, and they just get back to it and they're really, really happy, and you've kind of played a big part in their recovery. Though it's often, it's a massive team effort to get someone back, but as the surgeon, you normally play a decent part in that. So that's the best thing. And I think people often, as a doctor, it's really interesting. They just tell you all sorts of things. It's there's not many jobs where, you know, you'll just sit down with someone you've never met before and they just start telling you all sorts of, you know, details about them. They just open up. So it's a really privileged position to be in. And I don't really take it for granted, I think. I've been a doctor now for, well, since 2001. So, you know, over 20 years. And I definitely don't take my job for granted. It's a cool job and I really enjoy it, especially when it goes well, which is most of the time. So the question is, do I have any sort of catchphrase or mantra that I use in my work? I do have one. It's not mine. I probably borrowed from one of my old teachers, and I guess it would be the enemy of good is better. And what that means is sometimes when we're certainly in surgery, we want to kind of do something. We're doing a procedure, we think it's good, but we want to just make something even better. Sometimes you just got to be really cautious because that's when you can suddenly make things worse. So that's one of the things I normally tell my trainees. I think sometimes you just got to take a good result and accept it. And if you go really, really high, it's okay. And obviously we all want to excel, but sometimes, especially when you're operating on a human, you know, suddenly things can go wrong very quickly. So I think just know when to accept a really good result and just be happy with that. So that's probably my main one. I'm sure I have a lot more that my training surgeons would tell you, but none of them are coming to mind now. And some of them may not be suitable to go out on the internet as well.